Hey, welcome and thank you for joining the role of doulas in improving maternal and infant health outcomes. My name is Jennifer Marcis, and I'm Director of Health and Healthcare with Westside United. And in 2023, Westside United co-founded the Westside Healthy Parents and Babies program, and we're here today to raise awareness during Black Maternal Health Week. So thank you again for joining us in this critical conversation today.
Thank you, Jennifer. Good afternoon, everyone. Welcome to an amazing conversation we have lined up. I'm Janine Logan. I'm a midwife and founder and lead steward of Chicago Southside Birth Center. I want to start our discussion by saying Happy Black Maternal Health Week. This year's theme is Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy. And I'm super excited to introduce our guest panelists today. So I'll get right into it. First, we have Brenda Reyes. She is a bilingual registered nurse, community-based doula, and certified lactation counselor. As the chief of people and programs for Health Connect One, she has over 20 years of experience working with diverse organizations to create and implement peer support programs for birthing families and maternal child health quality improvement initiatives. Welcome, Brenda. Next, we have Aisha Sistrunk. Aisha is a young mother who deeply understands the importance of community, self-care, and reconnecting with our bodies. Through her platform work with Earthly Essence, she helps mothers find balance and nourishment through herbal remedies, mindful practices, and holistic wellness. Welcome, Aisha. Next, we have Dr. Robin Jones. Dr. Jones is an associate professor of obstetrics and gynecology at Rush University Medical Center here in Chicago. She currently chairs the Illinois Department of Public Health Maternal Mortality Review Committees, serves as clinical lead on the Birth Equity Initiative for the Illinois Perinatal Quality Collaborative, and leads Birth Equity on Rush Pursuing Equity Governance Committee. She currently serves as a member of several regional and national women's health and equity movement efforts. Dr. Jones has presented to Congressional Black Caucus and CDC, addressing maternal mortality and health inequities. She also has served on the Illinois section of the American College of Obstetrics and Gynecologists Executive Leadership Team as Senior Medical Director for several managed care organizations. Also a native of Chicago, Dr. Jones continues to influence her community as co-chair of the Westside United Maternal and Child Health Care Coordination Committee. She considers maternal health and the path to equity her calling. With a longstanding medical education track record on both undergrad and graduate levels, she forges a path forward for the next generation of medical physicians. Welcome, Dr. Jones. And last but definitely not least, we have Dr. Tanya Branch, who is currently the neonatologist at Northwestern Medicine, Lurie Children's, and the Director of High-Risk Perinatal Initiatives for Westside Healthy Parents and Babies. Clinically, Dr. Branch's work involves resuscitating and caring for critically ill neonates. Her academic work focuses on health equity, racial disparities in birth outcomes, and community-based interventions to connect families to resources and peer support to mitigate existing inequities. So welcome, Dr. Branch, and welcome to our lovely panel today. So why are we here? You might think of like, why is this conversation so important? Well, we have heard and have grown tired of the stats that are out there. We know that Black infants and birthing people are 3 to 4 times more likely to die due to causes associated with pregnancy and birth. While other races and ethnicities, birth outcomes are improving. But through this conversation today, we aim to increase doula awareness and hope to build on this year's theme by looking at ways in which we can build connections between doulas, providers, and communities and healthcare systems. I do want to preference, though, that we will be talking about doulas and systems, right, and solutions to those poor stats. But we don't want to preference this conversation where doulas are the sole responsibility and sole workers to mitigate and fix the systemic oppression. So that is not our goal today. That would take us many conversations and all of us doing the work to break down systems of oppression. So with that, I would love to ask you, Brenda, first, can you please talk a little bit about what a doula is and what are some of the beautiful ways doulas assist families?
Hi, everyone. Thank you for having me here. Thank you, Janine, for facilitating this discussion. So what are doulas? So doulas are folks, people that have been trained, mentored, to support uh, birthing families emotionally, physically, educationally, not only the moms, the birthing parents, but also their support system. And they do that during pregnancy, they do that during birth, and they also do that in the postpartum period. So when moms, birthing people give birth, then they go home. Doulas also can support. So that's the continuity of support that doulas provide from pregnancy, birth, and in the postpartum period.
Beautiful. Can you just share just a few ways in which doulas help families and what that can look like?
Yes. So doulas meet with families early in the prenatal period to connect with families, to get a sense of what are the dreams, what type of birth does the family want? So providing resources, providing education around options, providing sample birth plans, providing not only the birth plan, but also a postpartum plan. You know, what is that family support going to look like in the postpartum period? Linking them to resources, to childbirth classes, lactation classes, parenting classes, CPR classes. So there's a wealth of resources that could be overwhelming for birthing families as to, oh my God, I have to make all these decisions. What does this mean? And guiding and supporting them. But also, I want to acknowledge that doulas are super cool in building that voice, that strength, that confidence, that love, that connection in the prenatal period so that she can and her support people, right? We can all advocate for the type of birth that this family wants. And that is a big deal. That is a big deal. To have somebody that can listen to you, that can help you navigate a lot of, it could be very overwhelming. This doula, I want folks to be aware, a doula is on call 24/7 because we don't know when birth happens. So this doula is on call for that family to show up for them at the hospital. So at the hospital, you could do comfort measures. You could ensure that the healthcare team has the birth plan. Ensure that if she wants skin to skin, hey, you know, let's put the baby skin to skin. Hey, we can encourage the support person. Um, Postpartum period, ensure that she has a postpartum plan. Does she have a meal tray? Who will support her with cleaning support, navigating back to work, lactation, referrals? So there's a lot that doulas do and in the community and for also for birthing families. Those are just some examples. It's not limited to that.
No, that's perfect. And I love how you said doulas are super cool. I'm gonna get that on a shirt. But I really appreciate you building the bridge between the doula and the client, finding their voice and having the confidence to advocate for themselves. I want to pivot to you, Aisha. Can you please share a little bit about your experience as a birthing parent working alongside a doula? And then how did the doula support your birthing experience? And then lastly, how did you know that a doula was a good option for you and your family? or
Um,
even an option at all, excuse me.
so I'll start backwards. I knew that a doula was a good option for me and my family because when I had first went to the hospital and met the midwife who was supposed to be helping me through my pregnancy journey, it just didn't feel right for me. I remember getting in touch with a family member and they put me on to this doula center called Chicago Birthworks. And they had a doula who was studying to be a midwife named Denise Allen. Little did I know, we had our first conversation, and I was like, yep, I want her to be the person that helps me through this journey. I end up having my kid at home, and so Denise actually helped me deliver her, which was exciting experience. But that's what made me think that yeah, doulas offer sisterhood kind of for me at least. My doula helped me physically. She gave me a lot of information on what I can do postpartum. She was continuously a resource for me postpartum. And then she also helped me in the physical aspects of like delivering my baby, making sure that my baby was healthy, and different things like that.
That's so beautiful. I love how you speak about doulas being part of a larger healthcare team. Yeah, that's really, really important to understand, where you can facilitate and grow the team how you want. And so doulas can be a major part of that. Thank you, Aisha. Dr. Robin, can you please talk about ways in which you collaborate with doulas in supporting the birthing parents that you're working with? And what have you seen are some of the benefits of integrating doulas into your clients' care plans?
First of all, Janine, thank you for the invitation. Thank you for moderating this important, informative event. Let me start by saying I, I believe Aisha summed it up. And let's reimagine a framework where in the healthcare system, the patient is truly the center of what we do, and we provide holistic therapy. Imagine that world, and then imagine that someone like Aisha is looking to be a part or need services within that system. Well, I just said it's patient centered. I didn't say it's Robin centered. I didn't say it's Janine centered. I didn't say it was Rush centered necessarily. I'm saying it's patient centered. And when we look at patients, particularly from underserved communities, we have to hear what they're telling us. And what they're saying, what they're reporting is there are gaps in communication. There at times long extended times in getting in. There's delays in care. And so when I look at the system and when I listen to what patients are saying, keyword is listening, we have to your point, doulas are not the answer, but they are part of a broader solution. And with that being said, and when I think about being patient centered, to have someone, and I think Brenda summed it up wonderfully, to have someone who is knowledgeable, who is there to emotionally and physically support the patient, to have someone who's there who's going to advocate and be with that individual from the start. I, it's hard for me to say no. I don't want you in my patient on my patient care team. Instead, what I'm saying is when I look at my patient, when I look at the data that's coming out of studies that have been done over and over and over again about the gaps in communication, about the brief encounters that patients are having with their providers, I look at the Brendas and I say, welcome. Thank you for deciding to join me and the team in this endeavor. And people like Brenda are part of the team as far as I'm concerned. So I Aisha just reiterated what others have studied and reported on in terms of the benefits of having a doula.
Thank you so much. I really appreciate that. I have one more question to follow up on. Does your organization, or how do you connect and refer doulas that come and see you at your organization?
Great question. So we are currently at Rush working to partner with a doula organization, and that's not final yet, so I'm not going to throw the name out there, but we are working to develop a partnership with a doula organization. Prior to this being established, what we have in place is a list of referrals who are doulas and are willing to work with our patients and work at Rush. But
Amazing.
that partnership is extremely important, and that's why we want to formalize that relationship.
That's amazing. That is such a beautiful offering for clients that see you, and it's very rare for, I shouldn't say rare, but it's really progressive for formalized partnerships between healthcare systems and doulas. So thank you for that. Aisha, I also want to thank you for highlighting that doulas can be across all settings, because I think it's also needs to be understood that doulas can be for everyone and across all settings. Um, Dr. Tanya, I'm going to ask you a question. Can you please elaborate on how doulas are an asset for families and infants? And in addition to brothering people, of course, to help navigate through difficult transitions during labor from a provider perspective.
Thanks for having me here today, Janine, and thank you to everyone for being here. I think this is really important. And I'm happy to bring this perspective as a neonatologist and someone from more of the infant care side. I think often we think of doulas as being a support only for moms and birthing parents or only in the prenatal time period. But I think to answer your question, it's extremely important for families to have that support through delivery and postpartum, especially if their infants have to be in the neonatal intensive care unit. We know that that time point can be very stressful for birthing parents, for families, and for infants, not just physically, but mentally, emotionally. And we know that that trauma and that stress can actually lead to poor outcomes for those infants. So knowing that some of our particular families, our Black families, can have higher levels of stress that impact those outcomes, doulas can serve a really extremely important role in helping to reduce that stress, helping to provide support. We also know that creating a nurturing environment and being able to foster positive relationships can help infants have better outcomes in their development, despite having to go through the challenges of being in the NICU. So I think doulas can additionally serve in that role and supporting families and helping to create that nurturing environment, despite the fact that it looks different from what families might have anticipated with being able to take their infants home from the hospital together. Having to navigate going back and forth to the NICU, having to provide milk for your baby from home, going back to work earlier than expected. All of these things are things that I think doulas can help support families with. And I'll be honest that traditionally the NICU and our neonatal space hasn't always been a part of the conversation of working with doulas. And I think that's something that we can definitely do better. And I'm happy to be a part of taking that step forward today for my part of the field. I would also add that we have data to show that the time frame of when a baby goes home from the NICU out of that first month of life generally is a big driver for the outcomes of infant mortality and, poor infant health outcomes. And so being able to ease that transition back into the community, having a doula and other support systems to help you navigate going back and forth within the healthcare system or reconnecting back to your home environment is extremely important. So I'm excited to continue the conversation today about how we can continue to partner together to move things forward.
Thank you, Dr. Tanya. I really, as you were speaking, I was thinking about the time I was a doula before I became a midwife, and I spent a lot of time like moving milk around and helping people, get milk, from home to the NICU or food to the NICU. I think it's such a value that a doula can play, in assisting families. But I also really appreciate, the thinking that there's many ways that we can expand, how we are working together for doulas across, like I said, all these different settings. I'm going to go back to you, Brenda. From your experience, what would you say is the biggest barrier and or asset for doulas working alongside medical providers? I'm really curious in this question, because like I was saying to Dr. Branch, that a lot of times those families will call me first before they call their providers with questions and concerns. And so, can you speak to your experience, Brenda, of how, working with healthcare providers in collaboration as a doula can be either a barrier or an asset?
Yeah, so I could speak to both, Janine. Um, I think when there's lack of trust and understanding of what doulas do, um, when there's not awareness that doulas do not provide clinical care or diagnosis, um, there's also when there's shared understanding of, what are we doing together as a team for our communities, like Dr. Robin Jones. Who are we centering in the conversation? What's the purpose? I've seen when we don't have shared understanding there's distrust from the system. There could be bias from the healthcare providers, which impedes collaboration, impedes sometimes the vision of who we center and what's the purpose. And I've experienced both. And I've heard from my colleagues nationwide, their experience when there's shared vision and shared understanding, right? And there's trust, how we can collaborate and have hard conversations and how we can move the work forward. I've seen the biggest transformation and change when I work with systems and doctors and nurses and NICU nurses. When we have the vision that doesn't center us, but centers the families, and we're making a commitment to one another to sit at the table and sometimes have uncomfortable conversations, not easy ones. That's where I've seen our partnership flourish. That's where I've seen transformation happens. Because me as a doula, I'm vulnerable and I'm courageous, but you as a provider, Dr. Jones, are also vulnerable and courageous. And you, Dr. Tanya, are also vulnerable and courageous. And we can decenter ourselves and center the families and say, what are we doing here? What's the goal? What's our measure of success? And I will say, once we could address our shared vision, once we could address our bias, once we could address and make a commitment to build trust and work side by side and know what each other is doing, right? Get an understanding. I've seen the potential transformation that can do for families. That gives me hope, but it really requires intentionality.
May I also add, Janine?
Yes, please.
May I also add, Brenda, I think there's several things. that common goal, truly being patient centered and listening to what the patient is saying to us, it does not require that you negate my role or I negate your role. In essence, it's creating a system that can truly be transformative if we allow ourselves to reimagine how we're delivering healthcare and invite and engage professionals, and I use that word intentionally, like doulas.
Absolutely, absolutely. Even as my work as a midwife, we work a lot with doulas, and it's really that partnership and that trust, as you spoke about, Brenda, and that not having the idea that someone is there to, replace my role in the birth. Like everyone has a part in the birth, the partner, the nurse, the provider, the doula, even the client themselves. And there's been times where I'm like, can I talk to you? You have to tell me what's happening because you, as the doula, know this client probably deeper than I ever will, right? We have a good relationship, but I need to know what do you see us doing in this moment and having that trust to be vulnerable in that way, as you both spoke about. So thank you very much. Brenda, one more question. Can you speak to the recent insurance changes in Illinois to cover doula services? Like we're reading about doulas being reimbursed nationally, but we've had a huge win for doula reimbursement in Illinois. Can you talk about that?
Yes. So I don't know if the public is aware, our participants that are joining us today, that in December of 2024, there was approval for Medicaid, Department of Healthcare and Family Services medical programs to now approve doula services to be covered under Medicaid fee-for-service programs and for managed care organizations to be able to provide these services. So this is a big change in the state of Illinois because we didn't have that. Other states across the country have been implementing Medicaid reimbursement for doulas in very different, unique ways. No state, I would say, is implementing it in the same way. But this notification went out last year in December. So which means that families in Illinois now have potentially access to this type of support, and it would be covered through Medicaid. So this is a opportunity for our communities, but also for doulas in the state of Illinois to partner with managed care organizations to be able to provide doula support to families who are enrolled in Medicaid.
Thank you. I'd like to ask everyone, in thinking about what Brenda just said and explained so beautifully, how does this change and either improve access for families, or could a change like this be a possible barrier and financially for community doulas? And this is for everyone, if you care to answer.
Can I ask you what the question was again?
Do you think this change for doula reimbursement through insurance is uh, a, could improve access to doulas, or are there any barriers that this potential change can cause for doulas, sustainability, financially? What does it mean for community doulas?
What I would say is one, yes, this would definitely help for the people to be able to have access to doulas, but I feel like we need to take it a step further by having more conversations like these and telling people what doulas are, how they can support, because some people just don't know what a doula is. I know I definitely didn't know before I was pregnant and somebody passed that information on to me. And everybody may not have a person who can pass on information. So if there's any way that we could create informational pamphlets for people to grab while they're at the hospitals, or just having more open discussions about doula representation, I feel like that, including alleviating the cost of doulas, would definitely help.
Thank
I
you.
feel that, like any other profession, compensation is important. Let's not negate the fact that we need to make sure there is fair, and don't ask me to define it, is somewhere, fair compensation. And the fact that it's now affordable for everyone, that's a win. But we need to make sure that with that win, the person providing the service is fairly reimbursed, number one. We need to make sure there aren't innumerable hurdles in terms of paperwork to get the job done. Because if we are truly saying this is an important addition to our system, then we can't have unnecessary barriers.
Fair and timely reimbursement. I love that, Dr. Jones.
Agree with Dr. Jones, agree with Aisha. So this policy has passed. What is the process going to be for doulas to be enrolled, to be eligible to get reimbursed? That could be a barrier in itself. We got to remember that doula is not, we're embedding a non-clinical support into a clinical system. I want to acknowledge that. And that could bring its own sets of barriers. And that speaks to what Dr. Jones was sharing around what are the hoops that folks have to get paid and reimbursed appropriately. Aisha brought an amazing point. What is a campaign that's going to happen? Because you might have a great policy, but how about if you don't have the request of the public because we haven't done the investment to provide this information in our communities, the messaging and the messenger and the PSAs that are important for our communities, that are culturally relevant and appropriate. 3, what happens, right? How are we communicating? How are we building a workforce that looks like our communities? So we have to work on the end, on the consumer end, but we also have to have a workforce ready in our communities to respond to the need. Because the worst thing that we could do is focus on one on the other. We need to be working simultaneously, but then also on the system. How do we streamline the system to make it easy? How does the referral process, what does that look like? Until we know, right, what's the evaluation plan for the state of Illinois? What are the measures of success? What are the quality of the services that the doulas are providing? What are the outcomes? Again, what is our shared goal here? What are we trying to do? And what is our evaluation plan for that? And then how are we going to address problems as we move forward with this policy? A policy is always good, but how it's implemented, how it's evaluated, there is where there's a lot of answered questions there that we're gonna, learn by doing too, and trial and error. If we're listening to one another and communicating with one another, what that looks like, families, systems, and doulas themselves, the team.
I definitely agree with that, and everyone's made some excellent points. I'll just briefly add that as a provider myself and as someone who's on the pediatric side of care, I think educating our providers is going to be a big part of that. We educate the community, we've prepared our system, but they're still going to have to, come into a space. You made an excellent point, Brenda, that these are non-clinical professionals coming into a clinical space that traditionally hasn't always included them in every area. And so I think it will take a big partnership, all these different pieces of the puzzle working together, working with our healthcare system to prepare for, including more people that can help serve our patients and serve our community. And I think the data point that you mentioned is extremely important as well. I think being on the healthcare side and the provider side, we understand data and we look at research and we look at all of these outcomes. And that's, the next question is, what do we do about them? We see these disparities that exist. We see these inequities. We see the need for our patients to be heard. So now we have a possible solution to that. So let's, start to put that in place and hopefully be able to measure positive outcomes from that and use that to drive things forward.
Thank you all such amazing points. I'm even curious of like how to do the larger system buy-in. So for example, Dr. Branch, Dr. Jones, you are champions in this work, but who is the person gonna tell the security guard to let the doula in at 3 in the morning when they don't think they should be there? Or the nurse who's overwhelmed because it's high acuity on the floor and doesn't want another thing to deal with? Like, how do we move past, all of the barriers to make sure that that doula ends up standing next to the family in the room when the family requests them and not being turned away? So these are all really good things. And I totally agree with you both. Like, we have a solution, we have access. But again, doulas are not this only solution. So what is our system, what is our healthcare system doing simultaneously to change systemic oppression and not just relying on the doulas and waiting for the evaluation to be like, oh, nothing's changed, it didn't work. No, it works, but the system has to change in order to see those outcomes work. So thank you all for sharing your insight on that. Brenda, just another, I'm gonna keep picking on you. Can you talk a little bit about Health Connect One and how it supports advocacy for doulas and birthing people, particularly Black birthing parents?
Yes. So Health Connect One has been around since the late 1980s. We're a national non-for-profit. We do training, technical support, and assistance. We work with organizations, different types of organizations who are interested in implementing a peer-to-peer support program, perinatal community health worker program, community-based doula program, peer lactation support program, which looks at and acknowledges that the solutions are in the community. And if we invest in training, mentoring, supporting perinatal community health workers who are trusted members of the community, we're not only building a workforce, we're also addressing the challenges in our own communities based on the needs of the community. So we partner with hospitals, we've partnered with WIC, with home visiting, with grassroots collective organizations who see a value in community health workers, who see the potential there. Again, not the solution, but part of the solution that can address maternal child health inequities. So I would say the majority of our partners across the country are organizations that we partner with, are organizations that are led by Black leadership, who are interested and see and value the need of a community health worker, and they want to address maternal child health inequities in their community. And they're like, we would like to use that model, right? Train people from our community, hire people from our community, implement a popular education model, get them paid an equitable pay because they're on call 24/7, and do that in a partnership way to address maternal child health inequity outcomes. In addition to that, we've done advocacy, right? We've done advocacy, we've supported, we've worked, we've partnered with Representative Lauren Underwood here in Illinois to support the omnibus bill, which invests money, right, to address maternal child health, again, address social determinants of health, provide funding for BIPOC community-based organizations, really looks at growing our perinatal workforce, midwifery, doulas, lactation support, really begins to look at integrating mental health, and also developing how we provide services to incarcerated people, looking at innovative payment models. So there's a whole bunch of individual bills that look at investments that address inequities. So that's something that we've worked on in addition to connecting with and advocating with other community grassroots organizations around the importance, right? Educating our representatives around the inequities that exist, how doulas play a role in addressing some of those solutions. We've also developed data collection system with our partners to also gather that data, right? That evidence to support and implement peer-to-peer support models, and then looking at what are those measures of success, what is that looking, what is working, what's not working, and then how do we continue to shift and change and monitor that progress in our own communities.
Amazing. Thank you so much for that. And now I have a question for everyone. Minding the time, I want to make sure we have enough questions for, enough time for the Q&A. Can you just leave a nugget of what you want folks here listening to this conversation to walk away with in terms of how we can collaborate together? What do you see as tangible ways doulas and healthcare providers can collaborate? Or anything that you want the audience to walk away with as we open it up for a Q&A.
I can go ahead and start. I am just so grateful that this conversation is happening today. And I think continuing to have this conversation, not just at the level of those who support this cause, but pulling in different people in different spaces to begin to partner and collaborate. So as you get FaceTime with your hospital CEOs and your, medical directors and your community members and different people that can begin to come together and work together to formulate a plan of actions, a way for doulas doulas to begin to be incorporated. We already see signs in the system that there is support for this with getting Medicaid reimbursement and having hospital systems like Rush, as Dr. Jones mentioned, that are already working to establish partnerships. So we can learn from what's happening at other institutions. It isn't lost on me that on our flyer for today's webinar, there's multiple healthcare systems, multiple community organizations, people of different professional roles that have come together to have this conversation today. And I think that that should continue. We shouldn't remain siloed in our own institution, in our own workspaces, having this conversation, but continue to talk with each other, learn from each other, and put our words into action.
I'd like to say, I would like for us to reimagine a transformative healthcare system that truly puts every patient at the center of what they do. I didn't say some patients. I didn't say patients with certain insurance, gender, skin color, ethnicity, zip code. Every patient at the center of what we do. And when we really, truly reimagine that, we, I believe, would welcome what has already been shown and told not only by Aisha, but by others to be a important, critical team member. So when you ask Janine, is security going to stop my team member at the door? Well, they didn't stop my nurse. They didn't stop my anesthesiologist. So if you are a part of my team, then you shouldn't be stopped at the front door because you're an important member and I have put into play credentialing or whatever is needed so you can come in through my front door as I welcome you. And when I say I mean collectively the system is welcoming you. So I'm asking for us to reimagine how we deliver healthcare, particularly to pregnant women and women of color.
I would love to, for the 77 folks that are part of our webinar that are here because you are light. To be curious, to be humble, to listen to folks, and to be open to hearing to people's story and their experience. And be open and be non-judgmental. To learn and be open to what are the experiences of people as it relates to how they're getting prenatal care, how they're getting care at the hospital when they're giving birth. What is their experience in the postpartum period? What is their experience with parenting? And really listening and being compassionate and non-judgmental. And I think when we begin to listen and honor our stories, that each one of us has a story. We can begin to reimagine what Dr. Jones wants us to reimagine. But first, we have to listen to one another and without judgment and really try to understand where the other person is coming from. So that's why I'm so excited that Aisha is here, because we get to listen to her story of resiliency, of love, of connection, of support, of joy that she was able to receive and support for her doula.
Aisha, did you have anything that you want the audience to take away from this conversation?
I would definitely say, um, look more into doula work, how you can support your fellow doulas. I would also say to try to connect with fellow doulas as well. I know that I'm aspiring to be a doula right now just to pay it forward. If you can find any way to just pay it forward to mothers, to doulas, to the healthcare, to get them to understand that we need these people inside of the healthcare system with us. I feel like just trying to have more open dialects about what a doula is, and how they support people and mothers in the healthcare fields, in the fields in general. Um, and yeah, just learning like how to more better take care of yourself, how to advocate for yourself in the healthcare fields as well, because that's important too.
Thank you so much, everyone. And just thinking back on the theme of this year's Black Maternal Health Week, Healing Legacies. I love this conversation because doulas really are rooted in tradition and the legacy of birth. When you had your community around you, you had your community honoring you as, we call it an ancestor returning as babies are born. So to bring that into the spaces where people are giving birth is such an honor and such a healing legacy for generations to come. And I want to thank you all so much for this conversation. We do have a couple of questions from the audience, and so I'd like to offer this to the panelists. Anyone can answer this one. How are health systems connecting parents to doulas? And how can doulas get referred to be included in some of those referrals that systems are doing with families? And if I'm not clear, like how can a doula, for example, Dr. Jones, be on your list of the doulas to be connected with families?
I can give a little bit of an update from the pediatric side with working with Westside Healthy Parents and Babies, which supports families early in pregnancy. But even in the NICU and postpartum, we're referring families to Westside Healthy Parents and Babies, which has been able to connect families with doula services. As I mentioned before, I think in the NICU and in the pediatric care space, we haven't been as active in making those referrals or having those connections. So I think that's something that we can continue to do and talk about. And I plan to, continue to go forward to connect with other systems to learn how they're making those referrals. But I think that, we've talked about adding doula services to our list of social work referrals, to our community resource referrals that we're connecting our families with once we interact with them at the neonatal side.
So we have a list of referrals that, I mean, just like I have a list of referrals for pediatricians, for example. We have a list of referrals for doulas that have either come through because patients have recommended them and or colleagues have worked with them, and we have that in our offices and our labor and delivery unit.
Okay, great. I wanted to offer space if anyone else wanted to answer. We have another question. Um, in addition to doula Medicaid reimbursement, how else can Black birthing experiences be liberated? Distress and paternalism often experienced in hospitals. I don't really understand that question.
I think the question was asking a little bit about that now that there is Medicaid reimbursement, there's some additional regulations and credentialing that has been a layer that's added, and that could be seen as a hurdle where, traditionally doulas have had a little more freedom and sort of been able to kind of provide this experience of liberation in the birthing environment. And I could anticipate, I have less experience probably to answer the question fully, but I could anticipate this being one of the hurdles. And I think that's an important aspect to consider as we had this conversation about incorporating doulas into the healthcare system more fully and into our hospitals, and making sure that we're equitable in the things that we ask from doulas to complete to be able to work with us, that we're not adding any additional barriers, any additional, certifications that are needed above and beyond what we would ask for others. And being mindful that, like, again, they're not there providing clinical care. So let's not, add any additional hurdles that they are not, trained and equipped to complete, but making sure that we're being thoughtful and mindful about that integration and providing them with the support. If there is a need for certain regulations and credentialing that has to happen, are we providing that education? Do we have resources for them? We want to fully incorporate them as partners and not say, oh, you can have a seat at the table, but then have the door closed when they show up.
Thank you for that. It also makes me think of once Southern Black midwives across the South were encouraged to be credentialed and regulated. Black midwives were basically extinguished because of the rules and regulations that states put on them, in justifying their ability to care for people. So it is a concern. It could be a barrier. And along with everything else that we spoke about in the conversation about reimbursement, equitable reimbursement, unnecessary barriers, and intentionality around like what credentialing means. But I would say that dueling is a liberatory practice to be in space and community with people. That does not mean that there's not a standard of training and care that doulas go through to learn and be educated on how to support people in community.
Can I
Janine,
also add, I agree with everything that Dr. Branch said wholeheartedly. The first thing we're going to have, I believe we have to start with is respect. So I'll make this simple. You can't call me Dr. Jones, but every time I look at you, you're Janine, unless you say, call me Janine. So, and that's very simple, but that's simple in a room where you're calling everyone else by their last name and you choose to call me by my first name. That's for me respect. So we have to start with respecting what doulas bring to the table. And then some of the other things, in my opinion, that are extremely important that Dr. Branch outlined, they will fall into play. And we have to make sure that we embrace the importance of respect.
I agree with Dr. Jones and Janine. I just want to lift that right now. there's a national organization that's trying to credential doulas and are positioning themselves in that way. So that could be very harmful for states who implemented Medicaid reimbursement, because each state decides, right? Each community, stakeholders decide how they're going to move forward, but this could change drastically how we function, Janine. And I do see the impact potentially of how we did licensure for midwifery and leaving people out of the field to be able to practice.
Yeah, I see that too. Um, and I see you spoke about it earlier, Brenda, I believe, and Aisha, you spoke about it too, increasing doulas that work specifically in communities of color, increasing the amount of doulas, because right now, with a lot of like public-facing doulas or advertised doulas, a lot of people think, oh, I might not be able to afford doula because these doulas are predominantly white. And so a lot of these referral lists in hospitals are doulas who have like doula organizations and businesses and have maybe done birth in there before. And so those lists can be overwhelmingly white or non-BIPOC. And so now you have systems connecting community and families and community to doulas that are not representative of that community. So it's a really huge conversation that we can keep having. As we are out of time, uh, we had a lot of questions that we will follow up with directly via email. And I want to say thanks to everyone so much for joining today. This has been such an amazing conversation. Like I said, we could talk about this for days and days and days. I wanted to share a couple QR codes, one for the Westside Healthy Parents and Babies program. So you can use your phone, take a picture and get more information with that QR code. And if you will take a moment to complete the survey that we have for this conversation, that's the second QR code you have there as well. The Westside community members that are pregnant through 1 year postpartum can enroll with the Westside Healthy Parents and Babies program, and they can receive free lactation and doula support, as well as get answers to general questions throughout their birthing and pregnancy journey. So thanks, everyone. Sorry we went over 3 minutes, but we really hope you enjoy your day, and please reach out with any questions, and we hope you can take the time to fill out the survey. Thank you, Brenda. Thank you, Dr. Jones. Thank you, Dr. Branch. And special thank you, Aisha. Thank you all for being here today.
Thank you, Janine. Have a beautiful day.
Thank you. Have a nice day.
Thank you, everyone. Have a good day.